I'd like to tell you the story of how I became a periodontist, and it's a good opportunity for you to perhaps understand what a periodontist is and does, and how a periodontist is a little different from other dentists, all of that. So let me tell you my story. It really begins in my high school years. I was aiming towards medical school. My dad was a dentist and my uncle was a physician. So the two brothers, my dad and my uncle, knew about the process of going through that kind of training and instilled in us kids early on that that was a good direction to go, and so that was the direction I was heading. As it turned out, I became a dentist, and my sister, the youngest of the four of us, became a dentist and is a dentist. And we have two brothers, and they are both physicians. So all that tells you is that we lack imagination as young kids and basically followed the steps of my dad and my uncle. And so when I was about in my sophomore year, my dad came into my bedroom, sat on my bed and said, "Ben, I think you would make a good dentist. I'm not so sure you'd make a good physician because you have a lot of outside interests." And I was into music and I had other just activities. And he said, "That's kind of the nature of dentistry. You can work and then have a life outside of that, whereas medicine is a stronger commitment that work will dominate your life and you will have to be on call and do this and that." So he convinced me that I should look into dentistry, and so my first job, paid job, was as a dental assistant for him. He, when I was in junior high, had shut his office down. It was a general dental office in El Cajon, California. He closed it down, kept the building, but closed it for 2 years. And he went north 2 hours to Loma Linda University to become an endodontist. It took him 2 years, and then he came back into that office and opened the office back up as a specialist. The time in which he was up at Loma Linda with regards to the family was really a very good time in our lives, simply because he would go up there and he would live in our motorhome for 3 days, and he would come back and live at home for 4 days. So we saw a lot of him, and he would study, but he was around a lot. And so I remember it in a very positive way, this time and commitment that he had going up and getting this specialty degree. So that instilled in me a desire to kind of follow in his footsteps, and he loved what he did. And so I was not only interested in going into dentistry from early on, I was interested in going into endodontics, which is root canals, so that I could associate with him and that I would be in practice with my dad. That was a very desirable and attractive idea for me. So I ended up at Loma Linda University along with my siblings at their times for professional training. And in my first year, I was commissioned as a second lieutenant in the United States Air Force because they were going to pay my way through dental school, and I was going to return to them on active duty year for year of what they covered of my dental school expenses. Toward the end of my dental school time, my senior year, I made application through the Air Force for an Air Force general practice residency. This would be on an Air Force base, and it is a 1-year program for newly graduated dentists who are coming into the military. So it was all branches did this. In my case, again, the Air Force, where I would come in and be oriented on how to manage being an officer and a dentist in the Air Force, and they would take me through every specialty once again that is in dentistry. So I went through clinical times and lectures in all the subjects of dentistry. That's endodontics, general dentistry, restorative dentistry, prosthodontics, periodontics, oral surgery, a little bit of pediatric dentistry, a little bit of orthodontics, not much, pathology. And all of this was done in a year. And I credit that year for doubling my training, my skills over the previous 4 years, simply because the environment, now having a background in dentistry of the 4-year training, I could now move on and do more complete care with patients, and only need to come and ask people for advice and direction if I got stuck or had a question. They were available, otherwise I was working, and they were monitoring, and it was an excellent opportunity. The interesting thing is that when people ask me, well, how did you become a periodontist? Did you like it in dental school? The answer is absolutely not. I didn't like periodontics, nor did I like orthodontics, and later I figured out why. And the reason is, at least for me, is they were academic subjects, but they weren't clinical experiences that helped me a lot, because periodontics is the management of chronic things that are going on long term. And so although you can learn procedures, you don't really know how they heal and what the result is a year later or even 6 months later, because in dental school your whole objective is to complete all of the requirements and graduate on time, and that means you are focused on completing whatever requirements there are and getting out. You're not there to sit and ponder how treatment works and how to do it better. But that was what I could do in that 1-year general practice residency. And what happened was, it resulted in me, once I'd gone to my next assignment, which was in Germany, I ended up down a long hallway from the x-ray machine. The x-ray machine back in those days, this was in the 80s, was mounted to a wall, and they were expensive pieces of equipment, and then you developed your film in dip tanks. It was nothing digital about it as it is today. So today, faster, minimized x-ray, you could do it in any room. And back then, you had to walk patients from your room, treatment room, down to the x-ray room, get an x-ray, and then that would be processed and they would come back. It took a lot of time to do those sorts of things. So it would be best, if you're going to do the root canals for the clinic, to be situated right across from the x-ray room. And a friend of mine who graduated from the same general practice residency wanted to do that. So he took on the root canal work for that clinic. And they needed somebody to take on the perio, and that's where I began to become interested in doing periodontics. I became the clinic's more or less periodontist. And that's where I developed actually the explanation for periodontal disease that I call a tooth has 4 parts. And the point of that is, a tooth just has 4 parts. I can explain this to you so it makes sense to you, the patient, as to what periodontal disease is and what you're going to need to do in order to manage it with me. So that, you can see that video, but that was begun, that whole presentation started with my experience in Germany. And then I came back and I took a periodontics residency. In the meantime, I still had wanted to go into endodontics, but my dad, while I was in Germany, retired because he was having heart problems, and he decided, no, I'm done, and he got out. So my future desire to work with my dad evaporated. That wasn't going to happen. And so I considered, well, what is it that I'm mostly interested in right now? And I was mostly interested now in periodontics. And periodontics is, as I said, the management of chronic things. It has a surgical component to it that interested me, but it also had a very high didactic component of science and medicine and things. Those also were very interesting to me. And compared with general dentistry or restorative dentistry, you're working on a hard substance called a tooth, and you're doing things with dental materials and restoring a tooth. That's a very different thing than working in soft tissues. You're near the teeth, but you're around the teeth. And what I also liked about periodontics was it's a starting point for people who come into dentistry. In other words, people who've been out a while. A good place for them to start is for an examination of the tissues and structures around a tooth. So that placed periodontics and myself at the beginning of dental treatment, complicated dental treatment, because you have to take care of the foundations before you can restore on top of it. So it's an especially that's involved with other disciplines of dentistry, and I really like the team approach to things. So it was very enjoyable for me to get involved with complicated care and taking care of a component of it, while other specialists or dentists specializing in other parts of dentistry would do those other components. And so that fit my personality as well. I like to be involved, and I like the analysis of problems and figuring things out. And as you can tell from me talking, I like communication. I like trying to explain things to people. That's why I went to, after my residency training, I went back into teaching in a program similar to the one I entered the Air Force to take, that 1-year program. It was no longer called a general practice residency. It was called something different, but essentially the same thing. And I got to help teach new incoming graduating dental students who are now dentists, new dentists, about periodontics. And I worked within a team of instructors, just like that team of instructors worked in my life. I got to work on with these folks that are just getting started in their career. And I actually have, one of my things I'm proud about is that there were a number of those young dentists who then became periodontists. So I'm kind of a grandfather periodontist, I guess. I don't know what I don't think I'm their father. Well, forget it. Anyway, I got some people who got interested in periodontics. I think I helped influence them. Can't take total credit, but they then became periodontists, and I get to see them periodically at meetings and things. That's really cool. So after I graduated from, I graduated from my residency, I went into this program, and then after that, I was assigned to be the head of what essentially is the dental equivalent, the Air Force equivalent of a dental hygiene school. So I got to be an instructor and create training for the equivalent of hygienists. And so that whole process has kind of been incorporated into my philosophy and my practice and how I work with dental offices and dental hygienists. I know a lot about what they do and how they do it because I was involved in the training and instruction of that aspect. So I have these kind of quirky little background things that make me kind of different in how I approach care. But my philosophy is, I think that I need to partner with patients and give them enough, equip them with enough information for them to manage as much of it as they can for themselves, and then I support them in it. And so that's kind of how that all came about. So when people ask me the shortest answer to how did you become a periodontist, my answer is it was a long hallway. I'm a periodontist because there was a long hallway in my life and it changed my directions, and that's why I went into this specialty. It kind of is the story of our lives, that we have our plans, but sometimes God changes the directions and we find ourselves in different places in life than we thought we would be. And a lot of times that's perfectly fine. And we learn and we grow and we're different. So I have a lot to be grateful for all of the people who instructed me all the way along, and my dad especially for giving me this wonderful profession and showing me what the possibilities were, because I had no idea. And so I honor him in that. He passed away in 2010, and I miss him. But he is a very significant person in my life as to how I treat and manage people, because that's the way he did it. So I watched how he took care of people and what he was like, and I try to do that same thing myself. So anyway, you know now a little bit more about me, and I look forward to engaging with you in any way you want. Talk, communicate through this kind of format, or come see me, whatever you want. Have a good day.